Activity 6 talks about a mum coming into practice with a small child, an 8-month-old baby, who she claims has a fracture. When you're trying to look into the system, you realise that the child has an icon on the record that says they're on a child protection plan. We've asked you to consider what needs to happen next. I will give you a little bit more of context. Mum was extremely vocal and quite aggressive when she came to practice, and she was very unhappy that the advice she was given was to take the child to A&E. The really important part of managing a case like this is to remain calm, involve a clinician as soon as possible, make sure that you let them know exactly what the mum has said to you, and it is very important that you actually note down what she said to you. The reason why I'm making such a point of saying this to you is because when we talk about injuries to children, sometimes we go onto the arena of a non-accidental injury, so an injury that has been inflicted on a small child. And to identify this, sometimes we have to pick up on inconsistencies in the stories being given by parents. So if what she told you that had happened to cause this potential fracture is completely different to what she has said to the GP and what she will say to her social worker and what she will say to the A&E consultant, then that gives more evidence for us to be assured that this is a safeguarding concern and it needs to be progressed as such without delay. It is also really important that safeguarding processes are very tight, and they will be led by one of the clinicians, either a GP or one of the practice nurses. It is important that they consider how they're going to ensure that the child receives the adequate medical care. This may mean having to ring the consultant on call in the hospital and telling them that a small child is coming their way with a possible non-accidental injury. It may mean having to pick up the phone and discuss it with the allocated social worker. Remember, the child has a child protection plan in place. This means they will have an allocated social worker. They should know that this is happening because they can support the process of safeguarding the child further. It's also important to acknowledge that it is likely that at some point, if this is in fact a non-accidental injury, the practice will receive requests for information, either under a section 47, and we'll cover that in a little while, and that those are passed on to clinicians without delay so they can be completed and information can be contributed to any safeguarding processes that are ongoing.